Thank you, the organizer. Thank you for invitation. My task going to cover on the emerging issue on hepatitis delta in Asia. Here is my disclosure. So the outline of my talk going to cover the prevalence and route of hepatitis delta infection, impact of hepatitis B vaccination in hepatitis delta, and more recent evidence of hepatitis delta burden and take-home message. As you are aware that hepatitis delta requires hepatitis B as a helper, co-infection with both viruses can result in more progressive disease, more decompensation, as well as higher incidence of hepatocellular carcinoma. The pattern of hepatitis delta infection can be either co-infection, that means infection of both viruses at the same time, usually can result, and more often it's going to be super infection with hepatitis delta on the patient with chronic hepatitis B carrier. Usually in this case, the virus will persist. Hepatitis delta is among neglected viral hepatitis because hepatitis delta test is not widely available, no highly effective treatment, and no commercial interest so far. The preference is not directly correlated with the burden of hepatitis B in community. Transmission in Northern Europe and in USA, mainly in intravenous drug user, where in Mediterranean basin is going to be in apparent parental, sexual, or family cluster. In Asia, most of the reports is found in IVDU and high-risk sexual behavior. As calculated by Patricia Farsi in 2003, it was estimated that hepatitis B carrier can have hepatitis delta of about 5%. That was about 15 million in global burden. This is the study from Taiwan, include more than 50,000 hepatitis B carrier. You can see that most of hepatitis delta infection was prevalent in intravenous drug user in HIV positive, especially for those with HIV positive and history of intravenous drug. This is going to be the highest. Where in high-risk sexual behavior, like in MSM, also the incidence is higher than in general hepatitis B carrier, where the incidence was about 3 to 4%. And the longer the history of IVDU, the higher the incidence of hepatitis delta infection. As the estimate prevalence of IVDU by countries, fortunately, in Asia Pacific, the prevalence of IVDU is not that high as compared with in USA or in Australia. The same study has looked at the effect of vaccination in Taiwan. As you can see that in this particular uh, study, the prevalence of hepatitis delta in intravenous drug user has decreased from 85 to 91% in 1986 and 1988 to just about 39% in 1997 as the introduction of hepatitis B vaccine. An infection of hepatitis delta is not depends on hepatitis B genotype as well as hepatitis delta genotype. So we are anticipating the successful of hepatitis B vaccination, especially in Asia Pacific country where the vaccination can reach the WHO goal quite easily by 2030. As a result, we have seen the reduction of hepatitis B carrier, and we just hope that hepatitis delta will gone out of the Asia Pacific country. As you can see, the burden of hepatitis B as in 2004, about 350, and in 2015, just about 250 million in global population. However, recent study to look at the preference of hepatitis delta. This is the first systematic review look at hepatitis delta in global population. They have included every study and split into general population, mixed population, intravenous drug user, and high-risk sexual behavior. You see that I just draw your focus on in just Asia Pacific countries. Mongolia has about 8% in hepatitis B carrier, whereas in Pakistan about 2.5%. So with the burdens of hepatitis B in these Asia Pacific countries, especially in China and in Pakistan, altogether in Asia Pacific mainland, there are more than 25 million of hepatitis delta infection. So this is much higher than we previously anticipate. And the risk of hepatitis delta infection include intravenous drug user and high risk sexual behavior. As you can see on your left that in patients with intravenous drug user, the prevalence of hepatitis delta is more than 20%. And all of these account for about 60 to 70 million of hepatitis delta burden globally. More recent study to look at the prevalence of hepatitis delta. This is a study just published in September last year. So they look at the all study in all WHO region and split from general population in white, in hepatology clinic population in light blue, and in selected population in dark blue. You can see that the country estimate of hepatitis delta prevalence is about 4.5% in hepatitis B carrier. However, for the patients in hepatitis clinic, so the prevalence of delta is up to 16.4%, especially in the patient with cirrhosis or hepatocellular carcinoma, where delta can be found 18 to 20%. So the last study, they looked at the global burden of hepatitis delta. You see that even in China, the prevalence of delta is not that high, but due to the high burden of hepatitis B, especially in China, in India, in the Philippines, Pakistan, and Bangladesh. So you can see that top 5 countries burden of hepatitis delta are in Asia Pacific country, and China has contributed the most. So, ladies and gentlemen, regarding hepatitis delta prevalence in Asia Pacific countries, so the burden of hepatitis delta is underestimated, especially in Asia. Hepatitis delta prevalence differs depending on routes of infection, local culture, and unlikely from different in hepatitis B or hepatitis delta genotypes. Decrease in the preference of therapeutic injection, intravenous drug user, and implementation of hepatitis B vaccine are among the key factors of decreasing hepatitis delta burden. However, hepatitis delta in Asia is still high, especially in Pakistan and Mongolia. High hepatitis delta burden in Asia is the result from high burden of hepatitis B carrier. So this is among the most neglected disease, even not included in WHO goal. With that, thank you for your attention.